Women's bodies go through many changes, from monthly cycles to menopause, pregnancy, and all in between, making them incredibly complicated. Therefore, it's crucial to pay attention to any symptoms that could indicate a major problem, like cancer. This could include, among other things, bloating or unreliable menstruation, as this video will show us. One of the first steps in potentially preventing or even curing cancer is early detection. According to studies, those with cancer who are treated quickly have a better chance of making a full recovery. Don't disregard any unexpected symptoms that may emerge, and be aware of the 14 cancer indicators that most women overlook. Number 1. Unusual breast pain or changes. In the US, breast cancer is the second most common malignancy after lung cancer. Be familiar with your breast and keep an eye out for any strange lumps, redness, or thickness. It is advisable to have a specialist look at any skin lesions you notice, because they could be signs of inflammatory breast cancer. Additionally, consult a doctor right away if the shape of your nipples changes or if you observe an odd discharge. Because breast aches are frequent during the menstrual cycle, women frequently ignore them. They might be also a precursor to breast cancer though. Therefore, having a few tests such as mammogram, an MRI, and an ultrasound is the greatest method to prevent breast cancer. Along with your annual gynecological exam, you should also have a breast examination. Number 2. Unexplained weight loss. Most women today will go to great lengths to shed weight. However, it's not a good indicator if you lose 10 pounds in a month without increasing your exercise or creating a calorie deficit. Unexpected weight loss may be an indication of cancer and its early stages. Cancer cells consume a large portion of the body's energy, which can cause weight loss. It is better to identify the problem as soon as possible because, among many other things, unexplained weight loss may be caused by an overactive thyroid. Go to the doctor if you experience unexplained weight loss, have your thyroid examined, and potentially have a CT scan performed to rule out any other options. Number 3. Unusual bleeding. Women typically discharge vaginal or rectal bleeding. If you don't have a regular menstrual cycle, bleeding from the GI tract or between periods can be misinterpreted for period bleeding. More than that, women frequently avoid admitting they require serious checkups since odd bleeding indications can be so frightening. Don't dismiss bleeding after menopause. It's another red flag that could indicate endometrial cancer symptoms. Gastrointestinal bleeding could be a sign of colorectal cancer. Basically, you should check with your doctor and get all necessary checks done if you experience any unusual bleeding or spotting between periods in order to avoid any significant issues. Number 4. Chronic pelvic pain. Chronic pelvic pain might seem as frequent bloating, a constant sense of being full, or even trouble. Bloating after urinating is a regular occurrence in women, especially before or during periods. Therefore, it is simple to disregard it for the same reasons pelvic and stomach pain may continue to be unnoticed. Having these symptoms occasionally can be typical for most women, but if they happen regularly every day, week, or month, you should contact a doctor. Ovarian cancer may be indicated by persistent pelvic pain or frequent bloating. Urinary issues, such the desire to use the restroom immediately or the inability to completely empty your bladder, can also be indications of cancer. Number 5. Extreme exhaustion. Do you feel the desire to take naps throughout the day? No matter how many coffees you drink or how much sleep you get, does it ever go away? There is no comparison between this tremendous tiredness and the way you typically feel after a long day at work. Extreme weariness may be a precursor to cancer. Cancer cells require every nutrient in your body to grow and thrive, but your body is no longer able to restore them all. Because of this, no matter what you do, you could constantly feel exhausted. You should visit your doctor if you experience any symptoms of unusual weariness, low motivation, sadness, or low energy levels. Number 6. Irregular periods. Inconsistent menstruation is another indication of malignancy. Fibroids may be indicated by unusual painful periods and heavy bleeding. Fibroids are often benign, uterine lining growths. Your menstrual cycle may suffer greatly from their presence there. Cervical cancer can be detected if there is unusual vaginal bleeding during sexual activity or if a woman's period are thicker or linger longer than usual. Do not underestimate them. Visit your gynecologist once a year for a pap test that tests for cervical cancer along with the standard pelvic exam. Before we move on to the next fact, if you have enjoyed our video this far, subscribe now and hit the notification bell to get updates about health and wellness. Number 7. Changes in moles or freckles. Moles are known as beauty marks, as did Marilyn Monroe. One belongs to Cindy Crawford. They are fascinating, even fantastic. You ought to restrain them though. Check your moles periodically and let your dermatologist know if anything changes. Visit a doctor as soon as you can if any of your beauty marks are bleeding or if you unintentionally scratch one off. Skin cancer should not be taken lightly. Skin cancer claims more than 2 lives per year in the US each are. Melanoma, however, can be treated if discovered quickly. Number 8. Night sweats. Women may link menopause with nocturnal sweats. In fact, this is critically typical reason why women have nocturnal sweats. It's not the only one though. Another early signs of some malignancies such as lymphoma is night sweats. Night sweats can also be brought on by abscesses or bone infections. Therefore, if they occur regularly, you should get checked out to rule out anything including cancer. Number 9. Blood in the stool. Most women choose to ignore the significant issue of blood in the stool. They can assume it's related to their period or they might attribute it to hemorrhoids or constipation. Blood in the stool is abnormal though, so it should not be disregarded. Blood in your feces might indicate dangerous conditions like colon cancer. Number 10. Lymph node. Additionally, concerning is swelling the lymph nodes. Keep an eye any lumps you find, whether they are in your neck, under your armpits, or elsewhere. Visit a doctor if it doesn't go away in a week or 2. The immune system of the body includes lymph nodes. From the neck to axilla, chest, belly, and groin, we discover them in groups all over the body. White blood cells in them serve as our body's initial line of defense against infection. Filtering the chemicals that pass through our lymphatic fluid is the job of lymph nodes. Therefore, enlarged lymph nodes indicate a severe infection in the body. You should have it examined. Number 11. Chronic headaches. If you've had migraines in the past, you might disregard any unexpected changes in how your head hurts. However, headaches can also be an indication of cancer or a tumor, as well as a sign that something is amiss with your health. Sometimes, a simple migraine might be as serious than you might imagine. Number 12. Urinary issues. Women experience urinary difficulties more frequently than do males. We also have a tendency to disregard urinary infections if they happen. Frequently because women are more likely to have them. Simple urinary tract infections or kidney malignancy are both possibilities. Urinary tract infections that are left untreated can spread to the kidneys and cause major issues. So visit a physician. Don't delay doing it. Therefore, you must not disregard any of these warning indicators that may arise on your path. Number 13. Chronic coughing. Another symptom we miss is coughing. You might disregard it if you believe you have the flu, a cold, or an allergy. Coughing that lasts longer than 2 weeks is not normal though. You should go check it out if it is not accompanied by any other cold symptoms. It can be indication of leukemia or lung cancer. Don't ignore your coughing. By the time you cough up blood, it can already be too late. Number 14. Mouth sores. Visit a doctor if you suddenly get jaw discomfort, numbness, or swelling without any obvious explanations. If you regularly consume alcohol or smoke cigarettes, you should inspect your mouth for red or white patches once a month. Visit your doctor if you experience any oral pain or a sore that doesn't heal. Any area of the mouth, including the lips, gums, and even the throat, can develop mouth cancer. The first indications that something is wrong are sore mouth ulcers. If you like the video, give it a thumbs up and share it with your friends. Let us know in the comments down below, what do you do to make sure that you are cancer-free? You might also want to check out other videos in our YouTube channel. Just click or tap the videos below here. Thank you for watching!